Liver disease is on the rise in the US. Women are at a higher risk of developing a certain type called primary biliary. I'm not going to go through this. This is going to be interesting. I'm going to let the doctor say it. It's called PBC, which is left untreated can lead to liver transplant or even death. Now, joining us today to learn more about PBC is Dr. Stephen Flam, a liver expert at Rush University Medical Center, and Rosetta, who's living with PBC and has advice on how to become an advocate for your health. But first of all, doctor, help me out. What is primary? What is PBC and who does it impact?
You were doing pretty well on that. It's primary biliary cirrhosis, PBC. PBC is an uncommon but increasing in prevalence liver disease that is under the umbrella of autoimmune diseases, which means the patient's own immune system, for reasons that no one understands, attacks and damages the liver. And over the years, if you do not diagnose this early and treat it appropriately, patients can require liver transplantation or die. So it's important not to miss this disease, James. And, you know, this disease, for reasons that no one understands very well, primarily affects middle-aged women between the ages of 35 and 55. Older women can get it, men can get it, but it's primarily a disease of middle-aged women.
Rosetta, can you describe how you were diagnosed with PBC and how it impacted your life?
Yes, in 2017, when I was pregnant with my youngest son, I went to put my contacts in one morning and my eyes were actually yellow. It was really scary. I started developing symptoms like yellow skin, fatigue, itch. My doctors thought initially that it was related to the pregnancy, but I didn't get any better. Eventually, I was sent to a liver specialist where I had a biopsy and blood work that diagnosed me with PBC. It was really frightening.
It sounds like. Now, doctor, can you tell us about the treatments for the disease and the latest approach?
About 25 years ago, a medicine that's a natural substance, it's in us already, called ursodeoxycholic acid was approved for treatment of PBC in very high doses. It does not cure, but slows the progression of the disease down, which of course is very important. The problem is, it works optimally in about 60% of people, but in about 40% of people, it does not work optimally. And one of the big advances in the field in recent years has been the addition of second-line therapeutic agents, one of which is Iqirvo, to treat patients that are not having an optimal response to the ursodeoxycholic acid. Now, Iqirvo is made by a company, Ipsen, that is compensating Rosetta and myself for our time today. But this medication for the patients not having an optimal response to first-line therapy achieved an optimal response in 51% of patients in only 1 year. Fortunately, the medicine is very well tolerated. There were uncommon reports of muscle issues, even liver problems, bone fractures were rarely reported. But this medicine, in my experience, has been very well tolerated. Now, if one of your listeners or viewers is eligible to receive a medicine like Iqirvo, they, of course, should have a careful discussion with their doctor about the risks and benefits of a medication like this before it's used.
Rosetta, can you describe the significance of the treatment for you and others like you?
Yes. When I was first diagnosed, I started a medication, but it didn't really change anything. My liver enzymes were still elevated. My husband and I actually made the decision to move our family across the country to be closer to a team of specialists that I was more comfortable with. After we moved, I started a second line of treatment, but it didn't work for me. Once I started the Iqirvo, my ALP numbers finally started to come down and my symptoms subsided. So for me, and this is just my experience, I started to feel more like myself again. I just think it's really important that we advocate for ourselves and talk to our doctors about your best treatments.
Doctor, what are some final takeaways you want the audience to remember about PBC?
Great question, James. I think there are three very important take-home messages that I would like to leave your viewers with. Number one, liver disease in general. You don't have to drink alcohol to have liver disease. Number two, you can have liver problems and feel well. And it's very important for a patient to convince their healthcare provider to send them to a specialist if their liver blood tests are off, even if they are feeling well, so that a liver problem can be identified, like PBC, early, so that it can be treated to help them in the end. And thirdly, primary biliary cholangitis has lots of information available on the internet for afflicted patients and their families. One great internet resource is a site called iqirvo.com, IQIRVO.com. Lots of good information here for patients that would like to read more about this problem.
Doctor, what's interesting to me is when you said that our own body is attacking the liver. Explain that one more time.
Well, there are a lot of autoimmune diseases out there, James. Lupus, rheumatoid arthritis, psoriasis. These are all diseases where the immune system attacks your own body and hurts yourself, which of course is not a good idea. PBC is a disease where the immune system attacks the liver. And we don't know why any of these happen. And I'm sure many of your viewers actually have been afflicted with these kinds of diseases. But PBC is one of them. And it's particularly important with this one, diagnose it early and treat it properly.
Rosetta, one last question for you, and I've got to ask this because you guys actually moved across the country and your husband, this whole family. How has it affected your family?
It was really challenging. It was, it's hard for everyone to leave their, our old life and come to a better one, but we have a lot of hope now. I think it's just really important that everyone prioritize their health, make hard decisions so you can have the best outcome.
Speaking of best outcome, and I'm hearing what you're saying, your husband and your family, are they very supportive of what's going on?
I could not ask for a better husband or a better family. They would literally do anything for me. It's very blessed.
Very blessed. Okay, so you're married to Superman. Okay, we got it. We got it.
Indeed.
Definitely. Rosetta, doctor, thank you so much for joining us on Morning Blend. You kind of caught me off guard with this. Thank you for correctly saying it for me, doctor. But again, it's just very interesting that our own immune system, and it's particularly in this situation, is actually attacking one of our organs. That is very interesting. Thank you again.
Thank you so much for having us, James.
Thank you.